Very good evening to all of you. Today we will be doing the very important MCQs of cardiology, that is cardiovascular system, medicine part. See, a large chunk of questions come from the cardiovascular system in all the subjects, including anatomy, physiology, biochemistry, in biochemistry, lipid metabolism, cholesterol, everything else. Then physiology, cardiovascular system, anatomy also, they regarding the heart, then tumors, everything come from the cardiology. So let's begin with the first MCQ. A 25-year-old male presented with a growth in the left atrium. Look at the image very carefully, photograph very carefully. The diagnosis is four options are given: A. Rhabdomyoma, B. Myxoma, C. Metastasis, D. Papillary elastosis. The left atrium has been opened to reveal the most common primary cardiac neoplasm, which is called the atrial myxoma. These benign masses are often attached to the atrial wall. They can produce a ball valve effect. They can ask a question like this: ball valve effect, by intermittently occluding the atrioventricular valve orifice. So the correct answer here is B, myxoma. A 45-year-old male presented with pulseless disease on examination following histopathological finding will be C. A. Granulomatous vasculitis, B. Fibrinoid necrosis, C. Leukocytoclastic vasculitis, D. Thromboangiitis obliterans. Here we can see the epithelioid cells and giant cells, and the epithelioid cells and giant cells suggest granulomatous vasculitis. Granulomatous vasculitis is seen in giant cell arteritis, that is temporal arteritis, Takayasu arteritis, Wegener's granulomatosis, Churg-Strauss syndrome, and Berger's disease. So this granulomatous vasculitis is seen in temporal arteritis, Takayasu arteritis, Wegener's granulomatosis, Churg-Strauss syndrome, and Berger's disease. So the correct answer here is A, granulomatous vasculitis. A 15-year-old male boy presented with pancarditis on myocardial biopsy. We have done the myocardial biopsy and it is presenting as pancarditis. Following finding was seen. What is the diagnosis? A. Aschoff nodule, B. Tuberculosis, C. Foreign body giant cells, D. None. Here you can see the collection of foci of swollen eosinophilic collagen surrounded by lymphocytes, primarily T cells, and occasional plasma cells. The Aschoff giant cells, also called macrophage of rheumatic fever, and anti-shock cells with an arrow. So the correct answer here is Aschoff's nodule. Factor responsible for cardiac hypertrophy: A. ANF, B. TNF alpha, C. CMYC, and D. TGF beta. Now, what is the pathophysiology of cardiac hypertrophy? The molecular changes include expression of immediate early genes, that is FOS, JUN, MYC, and EGR1. So the correct answer here is C, MYC. Bulky friable vegetations are seen in A. Rheumatic carditis, B. Infective endocarditis, C. Lieberman-Sack endocarditis, D. Non-bacterial thrombotic endocarditis. It is bulky friable vegetations are seen in infective endocarditis. So the correct answer here is B. Infective endocarditis. Heart begins to beat in A. 4 weeks, B. 5 weeks, C. 6 weeks, D. 7 weeks. Heartbeat begins by day 22 post ovulation and can be detected by Doppler ultrasound. It is week 4 post ovulation or fertilization and week 6 from LMP, last menstrual period. So the correct answer here is A4. Absence of conotruncal septum gives rise to A. Tetralogy of Fallot, B. Patent truncus arteriosus, C. Transposition of great vessels. D. Coarctation of aorta. The absence of aorta pulmonary septum leads to persistent truncus arteriosus. Conotruncal septum is other name of the septum. It is patent truncus arteriosus. B. Please click the link in the description box to join the ultimate Neet PG breakthrough blueprint event. It covers all the 19 subjects in just 2 days in a holistic manner so that you can revise the important topics in a thorough way. You click the link in the description box, the first 10 people will get the masterclass absolutely free. It is an online event and that please click the link in the description box. While measuring blood pressure of a cardiac tamponade patient, what advice will you give him? A. Hold breath. B. Breathe normally. C. Long and deep breathing. D. Short and swallow breathing. Now, how do you measure the pulses paradoxes? To measure pulses paradoxes, a manually operated sphygmomanometer is employed for blood pressure management measurement in the standard fashion, except that the cuff is deflated more slowly than usual. During deflation, the first cortical sound are audible with heartbeats occurring only during expiration. With further cuff deflation, cortical sound become audible on all heartbeats throughout the respiratory cycle. The difference between the systolic pressure at which the first cortical sound are heard during expiration and the pressure at which they are heard throughout the respiratory cycle quantifies the pulses paradoxes. Severe pulses paradoxes variably defined as more than 10 to 20 millimeter of mercury, and it can be palpated in a radial, brachial, or femoral pulses as a weakening or disappearance of pulse during inspiration. Since the depth of respiration influences the severity of pulses, the patient should not be instructed to change his or her breathing pattern during the evaluation. So he should be told to breathe normally. So the correct answer here is B, breathe normal. Name syndrome includes all. A. Nevi. B. Atrial myxoma. C. Myxedema. D. Aphylides. Name syndrome means Nevi, atrial myxoma, myxoid fibroma, and aphylides, not myxedema. Now, what is Lamb syndrome? Please remember Lamb syndrome. Lamb syndrome is lentiginous atrial myxoma and blue nevy. Blue nevy. So the correct answer here is C. It is not myxedema. It is myxoid neurofibroma. So the correct answer here is C. Cardiomyopathy neutropenia syndrome is also called as A. Pompey's disease, B. Barth's syndrome, C. Holt-Orange syndrome, D. Fraser syndrome. All these syndromes are quite very important and repeatedly asked in the question MCQ. Barth syndrome is widely regarded as a rare X-linked genetic disease. It is characterized by cardiomyopathy, skeletal myopathy, growth delay, neutropenia, and increased urinary excretion of 3-methyl glutaconic acid, 3-MgCa. So the correct answer here is B, Barth syndrome. Cardiomyopathy may be seen in all of the following: A. Duchenne muscular dystrophy, B. Friedreich's ataxia, C. Type 3 glycogen storage disease, D. alkaptonuria. The neurological disorder associated with cardiovascular involvement are Duchenne and Becker's muscular dystrophy, Friedreich's ataxia, genetic disorders of metabolic pathway like glycogen storage disease type 3, Fabry's disease, etc. It is not alkaptonuria. So the correct answer here is D, alkaptonuria. Causes of hypokalemic metabolic alkalosis with hypertension is A. Liddle syndrome, B. Bartter syndrome, C. Gitelman syndrome, D. All of the above. Now, what is Liddle's syndrome? Liddle syndrome is autosomal dominant. There is hypokalemia, low renin, low aldosterone, mutation subunit of epithelial sodium channel, SCNNB. Liddle syndrome is inherited form of low renin hypertension. transmitted with an autosomal dominant pattern. The molecular basis of Liddle syndrome is associated with abnormal function of epithelial Na plus channel, increased expression of the channel at the distal nephron apical membrane with subsequent enhanced renal sodium reabsorption. The most common clinical presentation of the disease is early onset hypertension, hypokalemia, metabolic alkalosis, suppressed plasma renin activity, and low plasma aldosterone. How do you treat the Liddle syndrome is based on administration of ENAC blockers, that is amiloride and triamterene. So the correct answer here is Liddle's syndrome. So the causes of hypokalemic metabolic alkalosis with hypertension is Liddle's syndrome. Now, what is Bartter syndrome? Precapillary pulmonary hypertension. Which of the following should be initial investigation in a patient with high clinical likelihood of pulmonary embolism? A. D dimer. B. Chest CT. C. Pulmonary angiography. VQ lung scan. It is D dimer. D dimer is 30-year-old male presented with complaint of chest pain since 2 days to emergency room with following ECG. Identify the ECG. A. Left main occlusion. B. LCX occlusion. C. Acute pericarditis. D. Acute pulmonary embolism. Here you can see diffuse ST elevation in all leads except AVR and V1. ST segment is cored upwards and PR segment is depressed. T wave inversion with or without ST depression. So it is acute pericarditis. Click the link in the description box to join the ultimate Neet PG breakthrough blueprint event. Identify the condition in the given ECG. A. PSVT. B. Sinus rhythm. C. Atrial fibrillation. D. Ventricular tachycardia. It is the atrial fibrillation you can see here. What is the most likely diagnosis of following ECG? A. Ventricular bigeminy. C. Electrical alternance. C. P. Pulmonary. D. Improper calibration. Here the ECG shows normal sinus rhythm with ventricular bigeminy. Every other sinus P wave is most likely hidden in the premature ventricular contraction and not conducted due to refractory state of ventricle after the PVC. Premature ventricular complexes. There is an abnormal QRS shape. So the correct answer here is A. Ventricular bigeminy. Sustained ventricular tachycardia is defined as VT that persists. A. 10 seconds, B. 15 seconds, 20 seconds, 30 seconds. Sustained ventricular tachycardia is presence of VT for more than 30 seconds. Identify the following ECG. A. AVNRT. B. Atrial fibrillation with WPW. C. Atrial fibrillation. D. The ECG shows narrow complex tachycardia, 220 beats per minute. There are no visible P waves. Subtle notching of terminal QRS in V1. Subtle notching of terminal QRS in V1. That is pseudo R dash wave. There is a widespread ST depression. This is a common electrocardiographic finding in AVNRT, and that does not necessarily indicate myocardial ischemia. So the correct answer here is AVNRT, atrioventricular nodal re-entry tachycardia. Identify the ECG. A. First degree block. B. Second degree Mobich type 1 block. C. Second degree Mobich type 2 block. D. Third degree block. It is second degree Mobich type 1 block. Which of the following murmur increase on standing? A. Mitral stenosis. B. HOCM. C. HOCM is hypertrophic obstructive cardiomyopathy. C. Mitral regurgitations. D. Aortic stenosis. It is HOCM where the murmur increase on standing. Which of the following antiarrhythmic can cause ocular changes in the picture? Here you can see the streak of deposit in cornea in concentric circle. It is more like deposit and it is seen with amiodarone. So the correct option here is C, amiodarone. The other complications of amiodarone are pulmonary fibrosis, corneal microdeposits, myocardia, liver toxicity, neuropathy, alpha receptor block causes hypotension, skin photosensitivity, toxic thyroid hyperthyroidism. Which of the following drug is contraindicated in a patient with given angiogram? A. Chlorthalidone. B. Metoprolol. C. Captopril. D. Enalapril. It is Captopril. Doifitilide is which class of antiarrhythmic drug? A. Class 1. B. Class 2. C. Class 3. And D. Class 4. It is Class 3.